is the Health Coverage Enrollment and Utilization Educational Series presented by the Health Access Program from Asian Americans Advancing Justice, Southern California, sponsored by Cedars-Sinai. Now we will walk you through the steps and process to apply for Covered California. So, how are the various ways that you can apply? You can apply online on the Covered California website. However, the online applications are currently only available in Spanish and English. You can also apply in person with a certified enroller. You can find an enrollment center online, and you have the option to filter by preferred language and location. You can also apply over the phone by calling the Covered California Service Center at 800-300-1506, which is available in multiple languages. Paper applications are another method to apply and are available in multiple languages, but applying online, in person, or over the phone will be safer, more secure, and quicker. During the application, you will be asked to provide information regarding your household members, income, and citizenship or immigration status. Some documents that you should have prepared are your proof of identity, such as your driver's license, ID card, photo ID, or passport, proof of citizenship or immigration status, such as U.S. passport, certificate of citizenship or naturalization, your permanent resident card, or non-immigrant visa documents. Proof of Social Security numbers, such as your Social Security card, tax forms, or pending application for a Social Security number. And proof of income, such as pay stub, income tax return, or wage or income tax statements. Even if you do not have one or some of these documents, you may still be able to submit an application. Please contact Covered California or an enrollment counselor for additional support. So, how do you go about selecting a health plan? At the end of your application, you can enter your health plan preferences, search for providers, and also select and compare various health plans. You will see a screen like this. There are many different tiers of health plan coverage offered by Covered California. Typically, the higher the metal tier, the higher the monthly premium will be, while the copays or deductibles will be lower, meaning more medical expenses are covered by the health plan. Financial assistance often comes in the form of a premium tax credit. You can choose to get the premium tax credit each month to reduce your monthly premium, or you can claim it when you file your taxes. Now, we are looking at a comparison chart of Covered California's 2024 health plan and coverages. It's a lot of information, but we will break it down for you. Please note that every year, the coverage level might vary slightly, so it's important for you to refer to the most recent version. At the very top and bottom of the chart, you can compare the coverage level of each metal tier and the deductible and out-of-pocket amount. A deductible is the amount of money you need to pay before your insurance begins to pay according to the terms of your policy. An out-of-pocket maximum refers to the cap or limit on the amount of money you have to pay for covered services per plan year before your insurance covers 100% of the cost of services. For example, a bronze plan has a lower monthly premium cost but only covers 60% of the average annual cost and has a high deductible and out-of-pocket amount. But a platinum plan would have the highest monthly premium cost, but it covers 90% average annual cost and does not have any deductible requirements and a lower out-of-pocket maximum. Now you can compare the coverage level for different services provided by your health plan. The number listed in the cell usually stands for the copay amount for services. A copay is a fixed amount you need to pay for covered healthcare services after you paid your deductible. For some health plans, there are certain services that are not subject to deductibles. For example, on the comparison chart, benefits in blue are not subject to a deductible, which means you would only need to pay the copay amount listed on the chart and don't need to meet the medical deductible amount. Therefore, if you have a silver plan, you only need to pay $45 copay every time you need to see your family doctor. Generally, plans with lower monthly premiums have higher copayments. Plans with higher monthly premiums usually have lower copayments. An annual wellness exam is always covered at $0 copay, which means once a year you are entitled to one physical checkup at no cost to you. As you are choosing a health plan, there are multiple things to keep in mind, such as coverage level, type of plan, provider network, essential health benefits, and total cost. First off is coverage level, which is the 4 tiers of coverage that we just explained. Second is the type of plan. Consider how much flexibility you want when seeing a specialist. In an HMO, you will need to get a referral from your PCP to see a specialist, except for in the case of an emergency. With an EPO, you won't need a referral, but you will have to stay in network, and with a PPO, you will have the most flexibility. With health plans, the more flexibility there is, the higher the monthly premiums or costs will be. Third is a provider network. Do you already have a PCP specialist that you are seeing, or a hospital you prefer? Check to make sure that they are included in the plans you are considering. Fourth is to make sure the plans you are considering cover the care that you need, such as any prescriptions you are taking. Fifth is to use the Shop and Compare tool to understand the total cost of your health coverage, considering both the monthly premium and any out-of-pocket costs, such as deductibles and copays. So what happens after you select a health plan? After selecting a health plan, click the Pay Now button to make your first payment. If you do not make your first payment online, you will get a bill from your health insurance company about 2 weeks after it receives your application. All future bills will need to be paid directly to the health insurance company, not Covered California. If you want to set up recurring payments, you will need to do so by contacting your health insurance company. Make sure to pay your premium every month in order to keep your health coverage. After completing your first payment, you will receive a welcome letter and brochure from Covered California. You will also receive an enrollment package and membership ID card from your health insurance company. Your coverage will typically begin with your plan the first day of the following month. How do you select a primary care provider? Your health insurance company will typically match you with a primary care provider who is in its network. You can change your primary care provider by contacting your health insurance company. You can request for transportation or interpretation services by contacting your health plan. Health plans are required to provide interpretation services. Next, let's review what dental and vision benefits are covered under Covered California. For dental coverage, all health plans include dental care for children at no cost. For adults, a dental plan can be added to the health plan purchase. Vision care benefits for children are included in all health plans as well. Vision care for adults is not included in the health plans, but the consumer can choose to enroll directly with 3 companies that Covered California works with, which are iMed, VSP, and Superior Vision, which are the 3 insurance companies selected by Covered California to offer vision plans to their consumers. Here are some additional reminders. For Covered California enrollees, you must report any changes such as in address, income, and family size within 30 days. In terms of renewals, Covered California renewals begin annually in October. Members will receive a renewal notice. During renewals, members can update contact information and application information, compare different plans, and find out if costs have changed. 15 days after the date on the renewal notice received in the mail, if you do not actively renew, Covered California will automatically enroll you into the same plan from your previous year and use the most recent household size and income information provided to determine the amount of financial assistance. Lastly, here are some QR codes and links to resources including the Benefits Cal website to apply for Medi-Cal, the Covered California application website, the Covered California Shop and Compare tool, as well as the AJ SoCal Health Access Resources page. Thank you for watching our health coverage, enrollment, and utilization educational series presented by the Health Access Program from Asian Americans Advancing Justice, Southern California, sponsored by Cedars-Sinai.